much. Well, we have all heard it. Early detection is the key to surviving cancer. And that's why things like pap smears are so important for women. And did you know that a pap smear screens for more than just cancer? Dr. Erin Showalter is with Grandview OBGYN, and she joins us now to talk about that and the importance of cervical cancer screenings. Good morning. Good to see you.
Hey, good morning. How are you?
Good. So, and we all know that certain screenings, certain cancers we don't have a screening for. So it's important that you do get the ones that we can find out early. Talk about that for a moment.
Right. So, mainly here to talk about cervical cancer today, but there are multiple cancers that women should be screened for. Cervical cancer specifically is screened for with pap smears, which women all know what those are. But basically, we're able to look at smears of cervical cells and vaginal cells and see if there's any type of abnormal cell that could become cancer in those screens. It also screens for HPV because we know as OBGYNs that HPV is actually the sole cause of cervical cancer. And then you go ahead.
No, I was just going to say, I thought it was interesting you were going to tell us where the word pap smear come from. How did that, how was that?
Yeah,
I don't think I've ever known that.
Yeah, so PAP is actually short for the man who actually came up with this idea of getting smears. He was a Greek physician by the name of Georgios Papanikolaou. And so we obviously call it PAP for short because that's quite a long word.
And for women who don't have, talk about the dangers of not having that regular testing done. I'll be honest with you, I waited over the year's time during the pandemic last year. I was working all the time and had canceled mine during that year, but finally got mine done. And you do feel so much better when you get all those tests done.
Right. Yeah, so actually cervical cancer worldwide is actually the largest killer of women. In the United States, it's not because we've implemented pap smears. The problem with cervical cancer is a lot of times without pap smears, people don't know they have it until late stage of the disease. There's not very many symptoms that are obvious that, someone will be like, oh, I have cervical cancer. So it's really important to get the screening so that if you do screen positive, that we can do further testing to be able to diagnose cervical cancer. And
it's because, too, that the symptoms can mimic other things that people think it is, and they don't think much about it. Is that right?
Right. Yep, you got it.
So I know sometimes we feel like, oh, it's probably nothing, I shouldn't have that checked. But when it comes to something like this, you shouldn't feel embarrassed about having your doctor check.
If you ever have any symptom that is abnormal for you, or even normal but happening at an abnormal time, you should always contact your provider and speak with them about it.
And so, the first thing that happens, what do you do?
So if you're diagnosed with cervical cancer, you'd be sent to a GYN oncologist. We have multiple of them around Birmingham, and they manage cervical cancer. So they would be the ones managing it. But sometimes surgical management, sometimes you need radiation. It just kind of depends on what the GYN oncologist thinks is best.
Now, we hear about false positives, false negatives in some tests. Can that happen in a pap smear?
Yeah, perhaps any screening test you can have false positives and false negatives. Not very common. Again, with a pap smear, you're looking at abnormal cells and also HPV. So when we say abnormal pap smear, it could be either one of those things. So you could have abnormal cells with HPV, which most of the time that's what's going to be, because we know that HPV causes the abnormal cells. And then, from there, you would have to have an actual diagnostic test, and that's because there are false positives that are not cancer. There's a lot of them. And so the next step would be to look at the cervix under a microscope in a procedure called a colposcopy. And that's when we take a biopsy of the cervix, and we're actually able to tell then if there's cervical cancer.
All right, I do want to wrap with this. I know there are probably people watching who they've not had their pap smears done. You get embarrassed if you wait 2 years, 3 years, and you're like, you're too embarrassed to even go to the doctor. Talk about that in just like 30 seconds and tell folks why it doesn't matter, just get it done.
Yeah, it's just really crucial. And, like you said in the beginning, early detection is the key to all cancer. And so I know we kind of talked about it a little bit, but cervical cancer is not the only cancer. So October, the month of October, is actually Breast Cancer Awareness Month. So really, really important that any women over the age of 40 or with significant family history of breast cancer is getting your yearly mammograms. We also just changed, not we, but the American Academy of Gastroenterology just changed the screening guidelines for colon cancer to the age of 45 instead of what was previously 50. So that's a colonoscopy every 10 years or as your gastroenterologist recommends. But with any cancer, like you said, it's just really crucial to detect it early so that potentially surgery can cure you. When you have late-stage disease of any cancer, you're looking at a worse prognosis.
Dr. Erin Showalter of Grandview OBGYN, thank you so much. A very important topic. Thanks for being with us.
Thank you so much.
All right.
Have a good day.
You too. Now here's Jay.